The views that I'm representing here is wholly owned by Professor Left Colonel retired John M. Okoth, who is a professor of nursing and clinical scholar in nursing education at Masinde University of Science and Technology. And the topic of our discussion is investing in leadership and policy agenda for the improvement of nursing and midwifery services. This presentation discusses investing in leadership and policy agenda to improve nursing and midwifery services. It concludes with discussion on investing in leadership and policy, and then lastly provides recommendation. Now, leadership and policy making is a great speak among such distinguished guests like yourself. And I am grateful and inspired by the spirit and the aim of ECSACONM, which is to foster strategic collaboration for professional excellence, and its primary goal is to improve the quality of communities within the ECSA health region through strengthening nursing and midwifery education practice, research, leadership, and management. Now, very often, you've heard nurses complain about policies that are not well thought out or have not involved nurses in their formulation. I think the previous session was very eliciting, and we didn't just have time. Many organizations around the world are voicing the need for nurses to become more involved in leadership, advocacy, and policy making. The importance of leadership and health policy training cannot be overemphasized. However, the widespread education and training of nurses about policy is yet to be realized. UN member states in 2015 adopted the 2030 SDG agenda, and it outlines 17 sustainable development goals. Of these, health is very central and contributes to realization of the 17 SDG goals. Directing resources to strengthen nursing workforce will have a ripple effect in improving health and non-health related targets. The nursing workforce is central to the improvement and delivery of health care throughout the world. The contribution of nursing to SDG 3 is clear and well documented. There are also documents that speak out on the importance of this issue of investing in nursing leadership. And one of them is the World Nursing Report, which highlights the investment in the nursing and midwifery. The nursing workforce is central to the improvement and delivery of healthcare through the world. The contribution of nursing to SDG 3, which is the theme for this conference, good health and well-being, is clear and well documented. And as nurses, we are uniquely positioned to mitigate the environmental and health-related effects of climate change through involvement in policy, advocacy, and research. Nurses play an essential role in the achievement of the 17 SDG targets because of their expertise, their global presence, and the reach to the remote areas or hard to reach and the vulnerable populations. To enable the full contribution of nursing workforce towards the success of SDGs and the achievement of UHC, there must be a strong, sustainable increase in investment in the nursing profession. Moving nurses from being the recipient and the implementers of the health policy decisions to being leaders with strong voice in the development or reform of policy will take concerted strategic efforts into the future. Nurses are expected to identify the issues deliberately and work with the other decision makers to advance healthcare policies. Nurses should understand the level of power and know who controls the resources of health services in their organizations. We are living in an exciting time for nursing profession, and nursing is on a professional wave of news lately. This includes the 2020 Year of Nurse and Midwife, the campaign of Nursing Now, and the Nightingale Challenge, the celebration of the 200th anniversary of Florence Nightingale's birthday, the release of 2020 State of the World's Nursing Report by WHO, the ICN, WHO, and other important bodies are making nurses to strive to mark and get more involved in leadership, policy, development, and advocacy. And this report, for ease of access, I think ECSACONM website has deposited those reports. You can be able to access them, including the ECSA Nursing and Midwifery Workforce Report. The current campaigns mentioned above are helping to drive leadership training for nurses. Because nurses have an intimate knowledge of patients and their health status and associated factors, they can make unique and sustaining contribution to how health policy is shaped. Despite its representativeness and the acknowledged relevance of its work, nursing is still invisible, overlooked, and undervalued in health policy making. Nurses have not fully realized their potential to engage in health policy, advocacy, and leadership. A number of reasons have been given for nurses' lack of involvement in health policy, and I think we know the myriad reasons that we give and excuses. Nurses may lack confidence and skills, etc. In conclusion, nurses are fundamental leaders in healthcare. Number two, nurses are half of the healthcare professions, and they play a vital role in health action, both the front line as well as management level. And three, politics and policy are at the core of health care, and improvement to population health and directly impact the working environments and conditions of nurses. Nurses' influence in health policy would protect patient safety, increase quality of care, and facilitate the access to the required resources and promote quality health care. And five, nurses should be knowledgeable about all issues. Six, the gap in nurses' education is the lack of engaging enough in health policy, advocacy, and leadership. There are recommendations that have been made. Number one, in addition to recognition and evaluation of nursing workforce numerical importance, it is essential to value high quality nursing for leadership. So value system. Number two, nurses need to access to well thought out policy training programs to be more politically shrewd or aligned to help shape policies. Number three, intensify the influence of nurses and midwives in global and national health policy and decision making. Provide the requisite knowledge, skill, and attitude to enhance leadership position occupied by nurses to more fully engaged in policy making. As key players in development of the profession, nursing governance, nurses should be represented at all levels of decision making. And six, it is time for nurses to be health legislators. 2027, prepare yourself from county assembly to the county governors, etc. Finally, nurses need to follow now more than ever before the traditions of Florence Nightingale in influencing governments to make changes in health and healthcare. With these issues in mind, nurses are calling upon National Nursing Association and other nursing organizations, nurses regulatory bodies, nurse leaders present, educators, to together join hands to strategize about how nursing policy training can be implemented and supported in the region. Thank you.